Hello, friends. I am Dr. Sachin Mittal, your host, consultant endocrinologist based in Chandigarh, 4D, that is Detailed Discussion Dialogues of Indian Diabetes, where we talk in detail about how patients with diabetes in our country are different, how we can help them live longer, live better, how, if they have complications, how we can manage those complications. But first of all, our focus is always on how we can prevent those complications. But in case that they are still there, how we can, help them in a way so that they have a good quality of life in the long run. So, in this show, we talk to eminent personalities in the field of diabetology, in the field of endocrinology, who share their years of experience and wisdom with you so that you are able to treat your patients in a better manner so that that helps improves outcomes for the patients in a better manner. We have a prominent guest today. The guest name is Dr. MVS Pullarao. Dr. MVS Pullarao is a consultant diabetologist at Vijayawada Diabetes Hospital. Dr. Rao has done his MBBS from Siddharth Medical College, Vijayawada, and completed MD in biochemistry from Guntur Medical College in 2001. After that, he's done number of diabetes courses from Joslin Center, from American Academy of Continuous Medical Education, and Dr. Rao is practicing as a diabetologist since 2003. Dr. Rao also has certificate course in diabetic foot from accredited society and also won the national award for the diabetic best for diabetic foot clinic in 2019. And also Dr. Rao has done a course in lipidology as well as a master course in hypertension from the European Society of Hypertension. So welcome, Dr. Rao, to the 4D episode. Pleasure to have you here with us.
I'm Dr. Mellitus practicing diabetology in Vijayawada at Vijayawada Diabetes Hospital since 2003. My main concern is prevention of diabetes from at an early age and also prevention of diabetic foot complications.
Yeah. So in this episode today, we are going to be talking about prevention and management of diabetes mellitus and metabolic syndrome. So diabetes mellitus, the prevalence figures are mind-blowing. The number of people who are aware that they have diabetes is runs into tens and tens of millions. And there are equally large number of people who have diabetes, but they are not actually aware that they even have diabetes. So that is again a difficult situation because A, they are not aware about that they have diabetes. So that means that they are not able to take care of themselves in a proper manner. Plus, many of those patients actually, when they are diagnosed, they already have some degree of complications, be it nephropathy, be it neuropathy, be it retinopathy. That is already prevalent by the time the patients present to us. Plus, very, very important thing which happens is that initially we know that in type 2 diabetes, there is a window of opportunity where we can prevent diabetes. That is, we can reverse diabetes also, we can prevent the progression from pre-diabetes to diabetes, or we can help, alter the clinical course in such a manner so that in long run, there is a better beta cell preservation, which leads to a innumerable advantage for the patients in the long run, right? And we have had number of studies which talked about this. We had diabetes prevention program which talked about not only the medication but also the impact of intensive exercise or diet control or versus medication. And over a period of time we also have had subsequently a follow-up of that cohort also. So which brings me to the first and the very, very important question, that many times when I see young adults, I see people everywhere, so everyone is so busy, there is so much of stress everybody has, and that usually leads to people having irregular meal patterns. And I wonder that the irregular meal patterns have just gone up over a period of time. I see that all the time in my practice, and I'm sure that will be the same in your place also, Dr. Rao. So what do you think? Is there a link between the irregular meal patterns, the development of metabolic syndrome, and diabetes?
Yeah, definitely. So whenever there is not proper maintenance of timings with food and exercise, the people tend to take more food, automatically which may lead to obesity. The lifestyle patterns also, they consume more carbohydrates and more fast foods. They're eating more and more insulin is increasing on the, and it is so accumulating as fat, and which is leading to insulin resistance. And because of stress factors also, youngsters also getting hypertensive, they're becoming hypertensive and insulin resistant. Even in my practice, I have seen very young adults, like children also. Some 9 to 12 years, there are 5 children with type 2 diabetes mellitus, not type 1 diabetes mellitus, for whom I'm trying to control them with diet and exercise, not putting on any pills or insulin. So irregular timings are definitely leads to obesity because of excess hunger, and they cannot control themselves, or they cannot keep themselves to control their hunger and satiety. డయాబెటిస్ గురించి అందరూ తెలుసుకోవాల్సిన అవసరం ఉంది. టుడేస్ టాపిక్ ఈజ్ prevention and management of diabetes mellitus and metabolic syndrome in India. Diabetes is becoming the capital of India is becoming the capital of diabetes. Every 1 in 11 Indian adults is living with diabetes, and over 53.1% of adults living with diabetes are undiagnosed. Every 1 in 2 adults with diabetes is undiagnosed. The number of people with diabetes in India is the second highest in the world. So more than 50 million adults in India have impaired glucose tolerance, which places them in high risk of developing diabetes mellitus. So these statistics are around 2017, which states about the Punjab is having 10%, Chandigarh 12.6%. So, but in 2021 census, all these stats have become doubled. Punjab is at around 25%. They are having Chandigarh 26%, Goa 26.6%, and Kerala it is at third place at 25.5%. So within span of 4 years, the number has doubled almost. So it is increasing with rapid speed. The diabetes is spreading like anything. We are all should take care of and should prevent diabetes. So what is the status of metabolic syndrome in India, and what is metabolic syndrome? So metabolic syndrome is a combination of insulin resistance, visceral obesity. Many Indians are apple type or pear-shaped obesity, and hypertension, hypertriglycerides, and low HDL cholesterol. So this prevalence of metabolic syndrome is high among Asians, including Indians, and is high among those having sedentary occupations. Many studies in India have reported a high prevalence of metabolic syndrome in a range of 9 to 48%. There's some variation between urban and rural populations, where urban are scoring more, it stands about around 45 to 48%, whereas rural population stands about 8 to 12%. Some areas it is touching 18% in rural areas also. Several studies and articles have noted that diabetes and other metabolic syndrome often occur together and may share common cause. And these include already spoke about insulin resistance, visceral obesity, hypertension, high triglycerides, and low HDL cholesterol, which consists about low HDL cholesterol, metabolic syndrome. So next. So what is the reasons of this metabolic syndrome? Main thing is sedentary lifestyle. So India is one of the fastest growing economies in the world. The country is currently undergoing a rapid transition and increased urbanization for the country. For example, the urbanization rate was around 35.3% in 2021 compared to 8% 1950s, and this had a major effect on the health of the population. Changes in lifestyle leading to reduction of physical activities due to the technological advancement, affluence leading to consumption of diets rich in sugar, fat, and calories, and high mental stress. This has led to obesity and a sedentary lifestyle, which ultimately disturbed insulin production and caused diabetes. There is a reason why diabetes among urban residents is higher when compared to the rural counterparts, both in North and South India. Next, so obesity is one of the major risk factors of diabetes. There has been little research focusing on the risk factor across India. Despite having lower overweight and obesity rates, India has a higher prevalence of diabetes compared to Western countries, suggesting that diabetes may occur at a much lower body mass index in Indian compared with Europeans. Therefore, relatively lean Indian adults with a lower body mass index may be at equal risk as those who are obese. Furthermore, Indians are genetically predisposed to the development of coronary artery disease due to dyslipidemia and low levels of high-density lipoproteins. These determinants make Indians more prone to the development of complications of diabetes at an early age, like 20 to 40 years, compared with Caucasians more than 50 years, and indicate that diabetes must be carefully screened and monitored regardless of patient age with India. So, actually, body mass index is getting outdated because of its limitations of the age, height, and body composition. So the more accurate factor is relative fat mass index is the main factor and getting importance for that. So next, now high cholesterol and high blood pressure. So if a person has high levels of cholesterol, then the extra fat in the blood sticks to the walls of blood vessels. Over time, this fat hardens and is known as plaque. Heart plaque can block the blood vessels, which makes the space narrow and leaves less room for the blood to flow. In the narrow space, blood flow slows down and causes some of blood cells to group and clot. If a blood clot breaks away, it can partially or completely block any arteries or veins. This can starve the heart of oxygen and nutrients and subsequently lead to heart attack. If it blocks the veins, mostly it happens in the peripheries, like it may lead to DVT, like deep vein thrombosis, which is life-threatening and an emergency condition. Then, additionally, high blood pressure due to narrowing of the blood streams put extra strain on the blood vessels. So, if it blocks the arteries, it leads to peripheral arterial disease, causing the patient to lose either toes or fingers. Sometimes it is life-threatening the, because the delay in the treatment may lead to kidney failure and other things. Next, so what are strategies for diabetic patients with metabolic complications? The first and foremost thing, physical activity. So regular physical activity can lower blood pressure and help manage blood glucose levels, besides providing other health benefits. Current CDC guidelines recommend a minimum of 150 minutes of moderate intensity aerobic exercise each week or 75 minutes of vigorous intense exercise each week. Daily 30 minutes of walk for 5 days a week or 15 minutes of high intensity interval exercise for 5 days. Either one is okay. So moderate exercise include brisk walking and swimming. People should also consider doing muscle strengthening exercise like dumbbells, push-ups, and weightlifting. Uh, One can consider an alternate days for these things, which lead to loss of fat and make the muscles stronger, and which helps to develop lean muscle mass, which is insulin sensitive. Lean muscle is very insulin sensitive, and thereby decreasing the insulin resistance. So one should consider this strengthening to add their strengthening workouts also in their physical activity schedule. So maintain healthy weight. So in order to maintain healthy weight, one should regularly do exercise and healthy eating habits. They should practice healthy eating habits. For people with excess weight, losing even a little can help reduce the risk of both high blood pressure and diabetes. The National Heart, Lung, and Blood Institute noted that 3 to 5% loss of body weight can improve blood pressure readings, and 10% loss of weight loss may prevent some cardiovascular complications by 20 to 30%. And one should follow a healthy diet. Dietary limitations are often recommended for managing cholesterol, blood pressure, and overall well-being. This typically includes eating plenty of fresh fruits and vegetables, focusing on high fiber foods including whole grains, limiting added salt and sugar, avoiding or limiting unhealthy fats such as trans fats and animal fats. Last but not the least, smoking, tobacco smoking causes blood vessels to constrict, resulting in a temporary increase in blood pressure. It also increases the buildup of plaque within the arteries, which can lead to increase in blood pressure over time. Tobacco smoking can also increase the risk of type 2 diabetes. Smokers with diabetes have high risk of developing serious complications, including heart or kidney disease, retinopathy, which is an eye disease that may lead to blindness, poor blood flow, making infection, and the risk of foot or leg amputation more likely. Peripheral neuropathy, which can cause nerve pain in the arms and legs. So one thing that was not mentioned there was about alcohol. So one should also quit alcohol. The liver, because of diabetes, the liver is also bearing most of the stress. So if the people continue to take on alcohol, which leads to hypertriglyceridemia, many of diabetics have fatty liver. If they continue drinking alcohol, the fatty liver they may enter in the third or fourth stage, which may result in hepatic failure also. So what are the treatment strategies for diabetic patients? So early initiation of combination therapy. It is an approach to achieve glycemic goals earlier and delay the deterioration of glycemic control, and with possible better preservation of beta cell function. Novel medication therapies you are used with diet and exercise to control high blood sugar in adults with type 2 diabetes. They are DP4 inhibitors, sitagliptin, saxagliptin, linagliptin, allogliptin, and SGLT2 inhibitors, dapagliflozin, and empagliflozin, and GLP-1 receptor agonists like glucagon-like peptide receptors agonists regulate and restoration of incretin function. So how do they act? SGLT2 and DP4 inhibitors, the fixed dose combination of SGLT2 inhibitors, D4 inhibitors is suitable option for Indians type 2 diabetes mellitus for following reasons. They are safe, and the rapid and sustained glycemic control. They improve both insulin sensitive and beta cell function, helps reduce body weight and blood pressure, extra glycemic benefits, reduce pill burden, adherence and compliance improves, and overall cost effective. SGLT inhibitors promote glycosuria, so they act above the renal threshold of glucose and excrete glucose through urine by reducing glucotoxicity, which is resulting increased fatty acid oxidation and weight loss, and thereby decreasing hypoglycemia. So many pleiotropic effects for this. So indirectly, pancreas effect when glucose is reduced in the blood, ultimately there are lesser insulin secretion, so increased beta insulin sensitivity and increased glucagon. And D4 inhibitors act, they have dual pancreatic effects like they increase insulin secretion and decrease glucagon. So they act, they have a incretin-like effect, so increased GLP-1 and increased gas action insulin peptide. The resulting, so but with these different inhibitors, there is weight neutrality and decrease hypoglycemia. So these different inhibitors enhance the half-life of DP4 enzyme, enhance the half-life of GLP-1, whose half-life is 1 minute. So by inhibiting D4 enzyme, these D4 inhibitors enhance the lifespan up to 4 to 5 minutes, and in a glucose-dependent manner. They only act whenever there is glucose in the circulation, thereby decreasing hypoglycemic episodes and sustain the action for a longer time. These are the best drugs for the maintenance therapy and for long-term benefits. SG2 inhibitors and D4 inhibitors combination for tight control of glucose.
So, as Dr. Rao mentioned that, with irregular patterns, there is a problem of more food. There is a problem of, the vicious circle of, hunger and satiety neither getting fulfilled. So, one very important thing which happens is that when patients have an irregular meal pattern, you can try that with yourself. When you're not eating on time and when you subsequently are eating after a period of time, you tend to crave for foods which gives you a lot of instant energy, right? You tend to crave for foods which have higher glycemic index. You tend to crave for foods which have low nutritional value. You tend to crave for foods which are less fibrous, maybe more processed, right? So as a result of which, what happens is that not only is the quantity of food going in into the body is more, but also the type of food is more towards the empty calorie. What do we mean by empty calorie? That is the food which does not have too much of nutritionist value but contains calories, right? So the type of food which has more empty calories, that actually goes up. As a result of which, what you have is that when there is a too much of glycemic load inside the body over a period of time, along with the more food thing which Dr. Rao talked about, over a period of time, it just exacerbates the vicious cycle of insulin resistance, which goes on to develop a state where the patient initially becomes a pre-diabetic and then goes on to become a proper diabetic. Of course, it is irreparably linked with metabolic syndrome and type 2 diabetes. And this whole thing leads to a long-term risk of adverse cardiovascular outcomes for the patients. So we know that the prevalence of metabolic syndrome and diabetes has gone very, very high all over the world. And especially in our country, the prevalence of metabolic syndrome and diabetes has gone up very high. So what, according to you, Dr. Rao, are the reasons for high prevalence of metabolic syndrome and diabetes in our country?
There are many factors. So first, what I think is mainly the urbanization part. People are moving to towns, they're changing food habits, and industrialization is another part. And irregular food habits, and another habits like smoking and alcohol and stressful jobs. All these are causing them. So they are becoming prone and more prone to develop diabetes. So what happens with industrialization and urbanization is they're moving away from the routine activities like exercise, like regular walking, and they're using more vehicles to for their transportation. And as we have already discussed about untimely meals, they are becoming uh, more and more stressful in their jobs. And apart from these, we Indians tend to have obesity, apple-shaped obesity, which is more prone for developing diabetes. So all these factors, I think, is leading to the increased prevalence of diabetes in India.
So to put it in a nutshell, we have a situation where we, over last 2 decades, we have had a westernization of our lifestyle. The physical activity has gone down. but the food has become richer in terms of more empty calories, in terms of lesser nutritional values, right? Alongside that, there is a vicious circle of inactivity, and you put that on the top of the thin fat Indian phenotype, which puts us at a high risk of development of metabolic syndrome. As a result of thin fat Indian phenotype, we always had a predisposition. We always had a high risk. We always had a situation where we had, with the same amount of body fat compared to a Western or a Caucasian counterpart, we have more metabolically active fat. We had a situation where the more amount of cytokines were being produced, less things of adipokines, adiponectin, etc. was there, and more number of inflammatory cytokines were there in the system. All of this is leading to an endothelial dysfunction, which is leading to progression of metabolic syndrome, development of diabetes, progression of diabetes, development of atherosclerosis, and multiple other complications which are inherently a part of this. So this westernization of all things, and I think it has really got exacerbated with the lockdown. With the lockdown, we found even children, staying indoors, even classes happening on the phones, devices, laptops, and as a result of which nowadays we find that kids are more on their device, playing on their video games on their mobile phones rather than in the playgrounds. The obesity in young adults, in adolescents, has also gone up exponentially, and that is translating into a large prevalence of type 2 diabetes and metabolic syndrome at a younger age in our country. But there are so many other factors or other comorbidities which are associated with diabetes, which are associated with metabolic syndrome. So, but for the benefit of our viewers, Dr. Pullarao, can you share your thoughts on what are the other comorbidities associated with metabolic syndrome and diabetes mellitus, especially type 2 diabetes mellitus?
Yeah, obesity, the spectrum of insulin resistance. So obesity, hypertension, hypercholesterolemia, hypertriglyceridemia. So all these are causing them because basically we Indians are hyperinsulinic, so they are becoming more insulin resistant, resulting in, as you said already, endothelial dysfunction, getting atherosclerotic arteries, resulting in hypertension and more cardiovascular diseases, leading to puja. Another leading cause is peripheral vascular disease, so nephropathy. All these are result of this insulin resistance because of hardened or atherosclerotic arteries, which is the result of hyperinsulinemia in Indians.
Right, right. So, as Dr. Rao beautifully highlighted that, there are a number of other comorbidities which are associated with with type 2 diabetes, with metabolic syndrome. One is dyslipidemia. When we talk about dyslipidemia, one is hyperlipidemia and another is dyslipidemia. Typically, diabetes or insulin resistance can have a characteristic dyslipidemia where you might get a total cholesterol which may be normal, but it may be the LDL cholesterol which may also be normal, but your HDL maybe tends to be low, which is a good cholesterol, tends to be low. So the protective cholesterol goes down. The triglyceride tends to be high, which is a classical feature of that. And one thing which we need to remember is that even though that LDL cholesterol absolute value may be normal, but it still may be more atherogenic. It still may be more dense. That is why it is said that the component of a small dense LDL or the oxidized LDL, which is more likely to accelerate the process of atherosclerosis, is higher even with the total normal LDL cholesterol range. So that's why it can lead to a higher chances of the most important comorbidity of atherosclerosis, which can progress to a number of complications, be it heart failure, be it retinopathy, be it nephropathy, be it systemic hypertension, be it peripheral vascular disease, be it erectile dysfunction. Number of other comorbidities can be a part of it. So we need to be proactive, not reactive, in managing all of these things, and we need to target all the other comorbidities, other factors which are there. That's why we always talk, when we talk about management of diabetes, don't only talk about sugars. We always tell our patient A, B, C, and W. That is A for HbA1c, ideally less than 7%, or even lower if possible, unless and until somebody is very, very old and with low life expectancy. B for blood pressure, ideally less than 130 by 80, maximum 140 by 90 in certain situations. C for cholesterol, where we talk about triglyceride level less than 150, LDL cholesterol less than 100, or with a history of heart disease less than 70. And we also talk about HDL cholesterol more than 40 in more than 40 or more than 15 males and females respectively. So that's why, and W is weight. We want to make sure that the weight is well controlled. So this brings me to the point of LDL. So, why is LDL used as one of the outcomes of diabetes care? What is the real importance of LDL? And, just help our viewers understand more about these different terminologies and the lipid profile parameters, and how we should go about explaining that to the patient and targeting that in our patient's reports, and how we should tell them that, Doing only total cholesterol is not just enough. We need to, look at the complete picture actually. Dr. Rao, your thoughts on the same?
Apart from all these, so many patients are apprehensive about using statins and stenofovir like cholesterol agents. And once they are getting lowered and they become normal, they tend to stop these medications. So we have to educate them of not only lowering cholesterol in blood is enough, we have to prevent atherosclerosis also. So statins have also very important function of maintaining endothelial dysfunction. They prevent statins. So we have to educate them about the atherosclerosis and its consequences. So and we have to make them to use regularly statins so that we can prevent atherosclerosis by using regular statins.
Right, right. So use of statins is something which we should be doing, and use of statins can be done as a part of primary prevention, as a part of secondary prevention. Obviously, our goals can be different in terms of what value can be using. Obviously, in secondary prevention, we will be targeting slightly lower value, less than 70 or maybe even less than 55 in certain situations, right? And then even for primary prevention, we know that we basically are predisposed to heart disease, so diabetes additionally is considered a CVD equivalent, and as a result of which, even for primary prevention, it makes sense to use it in patients more than 40 years of age, in males or more than 50 years of age. Of course, it's a low dose plaque stabilizing effect which can be there of the medication. So that is where the dose of role of statins can come, and that is where we should be telling them. And we should also be mindful of the fact that there are so many controversies going on in social media about different adverse effects and everything, and we need to explain to the patient. It is our responsibility and our job to tell that this is the advantage and this is the disadvantage. But we have a risk benefit ratio. It's a delicate walk, tightrope walk that we do. In the best interest of you, it will be better if you take it, so you have a less chance of long term complications, right? But again, my mind always goes back to how can we prevent diabetes? The question of primary prevention again and again of diabetes. We know that it is much better to prevent type 2 diabetes than to treat it. So, what according to you is the current status of primary prevention of type 2 diabetes globally as well as in our country? What are your thoughts on that, Dr. Rao?
Okay, it start from the root level. Like first, the government should take initiative and it should be considered as an epidemic, and there is not much of supportive measures from government side in India. Whereas in Australia, New Zealand, government is very much supporting about this awareness campaignings and screening of diabetes. So only we physicians conduct some screening camps and at clinics are outside to screen out the diabetes and do pre-diabetes patients. And we have to make them aware of obesity and its consequences. It should start from school level also. So if we can stop at the at school level by bringing them aware of about childhood obesity and its consequences, that will be the first step. So every school should make it a mandatory about exercising and playing things, and also they should provide some time for the children to play at the ground. And there should be some. Of course, it is not to disgrace the children, but to make them aware of their body composition and to maintain ideal weight and height for their age, and make them aware of nutritious food and ask them to stop eating fast foods like pizzas and burgers, curtail them of eating out frequently. That is the first step. And then screening at some colleges and then offices regularly, and taking into consideration about the family history and their stressful jobs by promoting their daily physical activities regularly, and ask them to check regular blood sugar levels and cholesterol levels and hypertension after the age of 18 years. Like this, by stepwise manner, we can prevent occurrence of diabetes in future course of time. It should be a unified effort from all sections, not only from doctors. So
Right, right. Right. So, we should, look at things in a holistic, comprehensive manner. And, I really like the idea about the schools, because the earlier we started, the better it is. If we are able to create awareness in young minds about the importance of exercising daily, the importance of healthy eating, if we can make it as a part of a curriculum, if we can make it as a part of the habit of a child, that will be the best gift a parent, a teacher, or a doctor can give to the child, because that will lead to not only the prevention of obesity, that will also lead to a prevention of type 2 diabetes to a great deal. And when you're preventing diabetes or delaying diabetes, you're actually preventing or delaying a heart disease or a stent or a bypass or a kidney disease or a renal failure, for instance, or a stroke, for instance. That's why it's a huge investment which gives a huge return, less investment but huge return in the long run. Similarly, another very important risk group which we can target is gestational diabetes mellitus, because that is the age where mothers are very, very, receptive for everything, and we should tell them that, you are doing everything right now because you're concerned about the health of your children, but I'm also worried about your health. And when you deliver the baby, it should not that you should go back to the same old lifestyle. You should not do, again, that refined carbohydrate food to be eaten along. You should exercise regularly, and taking all the healthy preventive measures can go a long way in prevention of diabetes. So thank you so much, Dr. Pullarao, for your invaluable thoughts for the same. It has been wonderful having you today. It was the 50th episode of our 4D show, that is detailed discussion, dialogues of Indian diabetes, and our viewers will be enriched with your knowledge, with your experience. And before we go, what are the final recommendations or thoughts in your mind to prevent and manage diabetes as well as metabolic syndrome?
As I already said, first and foremost is screening, and then awareness, make them aware of health, healthy eating, exercise, and regularly. So when patient come to clinic, attendance are always there. So it's better to conduct free screening for them. Many of the parents think to get their children checked for is it they think as it a taboo, but we should make them free of that such thoughts and encourage them to check even for children the screening for diabetes and hypertension because childhood obesity is becoming more and more. So I think it is the best way to make them aware and to take steps to prevent diabetes in the future course of time.
Right, right, right. Thank you so much, Dr. Pullarao. We would love to see your presentation on the same topic. If you can kindly share your screen, and we would be happy to. Our viewers will be enlightened with your concepts, and happy to learn more from you. Thank you so much, Dr. Pullarao. Pleasure having you on the show. Thank you for sparing your
Then
time. I'm based in Chandigarh. Whenever you come to this part of the world, feel free to come in, and we'll